Ready.
Okay, so before your patient comes in, you're gonna find them in the patient schedule. If it's not in the patient schedule, you'll have to add them to new patient. So because right now we don't have a patient in there, we're gonna add a new patient because this has to be set up and filled out, and you pick your protocol in order for it to take your numbers. So right now we're gonna practice 1, 2, 3, 4. Gonna name it practice. Right?
Mm-hmm.
If I could spell, that'd be great. Practice. You put your initials. And tomorrow we're gonna have a head CT. So you're gonna go to the top one, and it's gonna be a tiny head because it's a cat. So it's gonna be small head, most likely sternal. So small head sternal. You'll pick that. Now go grab your numbers, which means the pet's on the table, and you're gonna tell the gantry how far you're gonna go and how far back you're gonna go. So we're gonna go over there.
Okay.
You're gonna turn your light on with this one, right? So your scan, your lasers come on. You come in. Don't have the head all the way towards the end of the table, because then you don't have anywhere to scan extra room. It'll only scan what's on the table. So move it back, right? You have the inner line. Give yourself some space. Zero it out, maybe an inch or two in front of the nose, right? I already showed you how the nose should look and how the laser should line up to it. Zero it out. Go all the way, and we'll say it's going to be around 300.
Okay.
So your S is 0, I is 300. You can leave it like this. So we'll go. Now it's white.
Yes.
Because it's going to take your numbers. If these were still red, it's not going to take them.
Don't believe it.
So it's going to be I 300, right? So this is your scout. And hit confirm. It's going to ask you to move your table.
Where's the dinosaur?
Oh, we're just
You gotta
scanning the
stand
bag
back
right
on there.
now for Hassan.
Oh, that's a good
Yeah, so.
Come on. Scan it. That's your first view. Do your second one. And you'll hit scan again. Okay, so from your scout, you'll go to next series, and you're going to change these to whatever they want. So pre-detail 1.25 or pre-detail 0.625. So we'll just leave it the way it is right now. And in a skull, all you really need is a detail and a bone. You don't need a lung because there's no lung there. So you'll brighten it by holding down that part and then bringing it all the way down. So let's say that's the head. That's why I told you to leave some space, because if you don't, then you can't column it, right? So check both views. Make sure you're not cutting anything off. If you have to move that, hold the X, hit shift, bring it down. Just make sure everything's still aligned. Go to your second recon, copy and paste it, and you're gonna be good to go. Just, make sure everything is labeled. Confirm. You're going to move the table. This is a head CT, so you don't need a breath hold. Everyone can step out. Once you hear that winding happening, you're going to know that scan is going to start. So you're going to start the scan. And these are your pre's that you're taking right now. So you did your scout, you hit next series to do your pre's. Now from your pre's, you're going to repeat the series off of your pre-details. So you hit OK. Now you'll change everything to post. On each recon, you have to go to each one. Okay, the only thing different now is you're probably going to add contrast. So you hit the preset list. If it doesn't say Omnipig 350, just type it out and hit OK. So then everyone's going to make sure they get out. You're going to hit confirm. You're going to move the table. Same thing, no breath hold needed. The wind up happens. And then this scan. And now you're doing your post. with contrast, obviously.
Yeah.
So my suggestion to you is that you relabel everything. Make sure you adjusted anything that needs to be adjusted,
Mhm.
and then once you're at the point where you hit confirm and you're waiting to hit scan, tell your tech go ahead and start administering your contrast, because then this is gonna say like pause or something. You're gonna hit resume, and you'll be able to then start your scan. So don't worry about it pausing on you. Just hit resume like a video game.
Okay.
Yep, and then you'll just make sure everything went through on this side. To see your image, you're going to be on ImageRx, sorry.
Mm-hmm.
ImageWorks is where you're going to go and highlight them up here. You're going to see your scans coming in, and you're going to reformat the post detail.
Mm-hmm.
And I'll show you more about how to do that tomorrow, because it's hard to do it without an actual anatomy to
Right,
see, because
right.
the sandbag doesn't have a sagittal coronal
Okay,
view, you know. So we'll do more about that tomorrow once you have like your own CT done.
Okay.
And then once you're like, okay, yep, everything went through, you can go ahead and end the exam. And then you'll highlight all of these, right? You see it's still coming in.
Yeah.
Highlight them, click, and then you'll click over here, and it'll send it over.
Okay. Cool.
You got it.